Objective number 5, inheritable diseases. Autosomal recessive are diseases that are found on autosomes and they are recessive. So two recessive alleles will be needed to result in the disease. So a normal individual would have two dominant alleles, a carrier would have a dominant recessive allele, and an affected individual who has the disease would have two recessive alleles. One of these diseases is Tay-Sachs disease. It causes a progressive deterioration of nerve cells and of mental and physical abilities. Begins around age 6 months, and it most likely results in death by the age of 4. This disease is most common in Jewish communities. Tay-Sachs is caused by a mutation in the 15th chromosome. A normal individual who is not a carrier would have two dominant alleles. A carrier would have a dominant recessive allele, and somebody with Tay-Sachs would have two recessive alleles. Sickle cell anemia is another autosomal recessive disease that is caused when blood cells are sickle-shaped. It's most common in African and African American communities, and carriers are protected against malaria. A normal non-carrier would have two dominant alleles. A carrier of sickle cell anemia would have a dominant and recessive allele, and somebody with sickle cell anemia would have two recessive alleles. You can see here the blood cells are sickle-shaped like a crescent moon instead of a circle. And this causes cloggings in blood vessels and arteries, which could lead to strokes and not getting enough oxygen to different parts of your body, which would cause a lot of pain for people with sickle cell anemia. Autosomal dominant diseases are also found on the autosomes, but these require just one bad allele, or one affected allele. So one dominant allele causes a person to have the disease. Having two dominant alleles would kill the child before they're born. Huntington's disease is one example of an autosomal dominant disease. It is much more common in people of Western Europe descent than those of Asian or African ancestry. A normal non-carrier would have two recessive alleles for this disease. There are no carriers of autosomal dominant diseases. Somebody with Huntington's disease would just have one dominant allele. If you've ever seen the show House, this doctor was diagnosed with Huntington's because she knew that her father had the disease. And the weird thing about Huntington's disease is that an individual doesn't know that they have the disease until around the age of 40 years old. There are tests that you can do to find out if you have it, but oftentimes people don't know that they have it before they have children and then pass on their trait. It affects the basal ganglia of the brain. Achondroplasia is another type of autosomal dominant disease. It's the most common type of dwarfism. A normal non-carrier of achondroplasia would have two recessive alleles. There are no carriers for achondroplasia, and a person with achondroplasia would have a dominant and a recessive allele.